For decades, Uganda has made significant progress in the fight against HIV. Advances in testing, treatment, and public awareness have transformed HIV from what was once considered a death sentence into a manageable long-term health condition for many. Yet one challenge continues to stand in the way of progress: stigma. Fear of judgment still prevents some people from testing, disclosing their status, seeking treatment, or remaining consistent with care. For others, the emotional burden of living with HIV can be as difficult as managing the virus itself. This episode explores how counseling, psychosocial support, and compassionate healthcare are helping people move beyond fear and stigma, remain on treatment, and rebuild their confidence. Through conversations with healthcare professionals, frontline counselors, and people living with HIV, we examine how support systems are changing lives and what more is needed to create communities where no one is defined by their diagnosis. Has Uganda made greater progress in treating HIV than in ending the stigma surrounding it? Everything comes back to that. Welcome to Impact Uganda.
Yeah, there is significant and great, of course, progress when it comes to the control of HIV. As a country and joining the rest of the globe, we've been having universal benchmarks, which we look at and see how far we've gone with this. And number one is to try to see that at least 90% of people who are living with HIV are let to know through testing, and then we ensure that they are linked into care. And then how are we faring on that? Uganda has done tremendous on that. At least we have achieved that first 90. And we are remaining with about 10 or 9% of those, which translate to about 150,000 Ugandans who are not yet tested and then linked into care. But these are unique populations, so meaning that we need to go smartly and then ensure that they are in. The other one is to ensure that 90% of those that we have identified actually put on treatment and on the life-saving HIV treatment. And we are not also doing fairly that about 89% of that has been achieved. But when it comes to those already identified, probably we could be better that way, that more than 95% of those tests have already been put on treatment. And coming on the last benchmark indicator that is trying to summarize all our efforts in this is the ultimate goal, which is viral suppression. We want to see that at least 90% of those that have been put on treatment actually virally or have their viral or the amount of HIV in their blood should be undetectable to a level that does not threaten the patient's immunity to be progressively going down or to pose the risk of HIV transmission in that case. So we are still struggling on that indicator, and in all these three universal benchmarks, we try to see that certain populations are doing well, others are still struggling, or we need to do more to ensure that they are also brought along the level where we need to be in that. So as Uganda, I would say, yes, some progress has been made. Benchmarking on the picture that we had like in 2010, much has been done. We've been able to reduce the number of new HIV infections from all the way where they were more than 100,000 people were getting HIV infected in a period of 12 months to come down to where we are about 37,000 that we are looking at, or the 32,000. So much of that decline has come from the efforts of all the players in Uganda. Stigma is part of humanity, especially anything associated with the negativity or having certain consequences will end. And here we are with HIV, a disease basically that we normally get through sex. Even before that, sex issues or sexual issues were not that freely discussed. There is a lot of stigma associated around it, and then the disease comes on, and then we know that you can transmit it to another person. So having a family member or a close friend or a spouse who has it, there is a way it will imply to those around this other person. And then the issue of the mother-to-child transmission also complicates this further. But also see that the internal stigma of the person who is also affected, somehow they end up being discriminated, denied certain rights, and this brings in the complexity where it ends up with the issue of stigma. But as we say that we cannot achieve those performance goals that we talked about, the benchmarks, people being tested, people being in care and adhere to treatment and eventually suppress, without the issue of stigma being dealt with. So it has been one of the barriers to either access from a personal perspective of things, but also sometimes it influences on how we arrange services and who do we reach and things like that. But I want to take it from how is it affecting the service delivery and access to this. We see that beginning with, because HIV initially was associated with death. You know, having that diagnosis years back would somehow mean that you are going to die. And no one didn't want to have such news given to him and so on. There are people who would delay, or rather delay, to test for HIV until actually they are bedridden. It means that so much that they need really to be to seek treatment and so on. So those are some of the consequences, delaying access to testing, which is the gateway to HIV prevention and treatment. But we also see that the issues of gender-based violences coming in, and once a spouse disclosed to the other that they are HIV positive, it could end either way. Either the relationship, the marriage breaking up could mean that someone is either going to be somehow harmed or hurt in one way or the other, either psychologically, physically. That also created that internal feeling that I should not give, or which is also another domain of stigma that is going to come up with that and so on. But we also know the issues of the side effects of the drugs. Certain people and the pills that we are giving by then, many doses, many pills that are going to be taken by this client, the other diseases associated with HIV like TB and so on, could also carry on the stigma that is coming from that kind of those comorbidities or the treatment that has to be taken and so on. But in the other way around, and what we want to thank the players in this, the government, the other agencies that have provided treatment. At least these days it is hard to tell that someone is HIV infected by just a mere look. Even when you move on the streets, and sometimes even in the hospitals, on OPD, it is very hard. That has been as a result of the treatment, which has helped to improve the people's health and minimize on that degree of stigma. But we also see the issue coming in from the side of other service providers. Could be from the spiritual arm of it, could be from the traditional cultural aspects of it, or even the community at large, on how they perceive what being HIV infected means. For instance, there are those initially who thought that it is a disease of what? Prostitutes. That either you engaged with a prostitute as a man, or the woman herself is what? A prostitute. That, of course, would stigmatize. There are people who do not stand that picture from the community, or to be perceived that way by the community, stigmatizes. There are those who see it as a punishment by the Spirit of God, that God has eventually punished this other person, or things like that. So it brings in that aspect and all. But through community sensitization, engaging those key stakeholders and what, but also the literacy on HIV and its treatment and so on, has tried to reduce the levels of that stigma coming in from such domains and things like that. Psychosocial support is very, very important, because in the earlier days when the HIV program, especially the treatment arm, is just starting, we thought that actually the key players would be the medical officers, or the doctors, to be knowledgeable in the drugs themselves and how to give them to the patients and so. And initially the program was designed to be implemented by doctors. But later on we realized that it's beyond just the treatment. If we want to see that patients remain in care and patients adhere to their treatment to become virally suppressed, you needed to address other domains of life. HIV did not come only in the aspect which is addressed by the medication itself. It has other areas that needed to be what? To be addressed. So psychosocial support comes in. And we are lucky that certain players, including HF, AIDS Healthcare Foundation, how it was founded initially before treatment came on board, it was basically AIDS hospice, trying to give quality life to those that were basically, especially in their late stages of HIV and disease. How do you ensure that they live a dignified life and probably end their life in an environment that is showing respect and does not judge and things like that. So, and here locally we had TASO, you remember, trying to give palliative and others. So mainly those were good foundation for psychosocial support to come on board and so on. So we realized that we needed, first of all, to work with the family that is spending most of the time with this client. And if things are not good in the community, the medication you have given may not be taken. We have seen where clients have to hide the pills in restrooms, in toilets, in the gardens and things like that, because the family environment is not that supportive to allow the client to take what? Medication. So we had to engage the family to be part of the team that is treating and managing the client, but away from the health facility. We have the other players in the community, as we talked about, the spiritual leaders and so on. But what we agreed is that we need counselors to come on board to join the medical doctors. And we train part of the patients, a cadre called the expert clients, those that had gone through some of these struggles of adherence and so on. We are equipped with certain knowledge and skills to come and help their fellow peers who are also struggling and so on. And we take that further to include that for the adolescents, the younger people, but also for the pregnant mothers and things for the general population, and including men and so on, to ensure that their peers are there to provide the support. So the counselors, of course, these are professionals who know how to look beyond just the medication, to look at other factors and so on. You know that certain conditions could predispose someone to getting HIV infected. Before someone is infected, they needed this psychosocial support earlier on, including those that have involved themselves in too risky sex, but also drug abuse and so on. So you need someone to come on board to handle that. But we also realize that the benefits of treatment beyond the patient himself, to include the community. So how do you maximize that? We needed to ensure that our patients do understand. We created a package through the umbrella of psychosocial support on the practices or behaviors that our patients should engage or conduct themselves while in the community, to ensure that HIV is not transmitted from them to the rest of the community members, but even them getting another strain of HIV as we are already, we are going on with their management in care. So it is that important that medication alone cannot realize you the benefits that we want, and the ultimate one being viral suppression among our patients. Number one is that, first of all, each and every one of us need to know our HIV status, and we say it expires every time you engage in risky sex, and this we mean that sex unprotected with someone you don't normally have sex with, or an irregular person in that case, meaning that it is not your spouse and things like that. Those with our spouses, this status expires every 12 months, and you need to know your spouse's HIV status if you are to be in control. So couple testing is encouraged. But we also call upon you, and we remind you that HIV is a manageable condition. Treatment is with us, and we all have a role to ensure that we support the country, support ourselves, support our communities, to try to see that we achieve HIV control. It comes in two arms. Number one, how you support keeping your HIV status negative, but also ensuring that if you are positive, you get on medication and ensure that your life is safe, but you don't pose a risk of transmitting that disease to your loved one and people in the community. We are here for you as HF with the support of government of Uganda to ensure that you live long and you enjoy this journey of life.
Uganda has spent decades strengthening its response to HIV through testing, treatment, and public education. Today, with access to antiretroviral therapy, many people living with HIV can lead long, healthy, and productive lives. Yet while medicine has advanced, stigma continues to affect how people seek care, disclose their status, and navigate everyday life. This episode explores why ending HIV is no longer only a medical conversation, it is also about dignity, acceptance, and ensuring that no one is left behind because of fear or discrimination. Treatment begins with diagnosis, but staying on treatment often depends on something equally important: support. We'll take a short break. Welcome back. We continue our conversation on living with HIV and the role that support and understanding play in long-term care.
Uganda Cares is an organization that deals basically in HIV treatment, HIV care treatment, and STI screening. This organization started in 2002 in February, and it started in Masaka. It is then that from Masaka, it also started another branch in Kampala. That is the clinic at St. Valley Kudembe Uganda Cares, where we are right now. When a client is first tested for HIV, the first thing that comes into the client's mind is death. The client thinks that she or he is going to die. They still have that fear. Those who have not gotten the education, they feel that they are going to die. They fear for the community. What will the community say? They fear for their families. Some come when they are they had dreams of going to Saudi Arabia, like for work. Unfortunately, the results come out, they are positive. That shatters their dreams. But through the services we offer, especially the counseling we give them, because we do professional counseling here, what we do enables them to stand up. And in doing so, you find that this person has gained hope. Life has rejuvenated. This person still sees hope despite being HIV positive. We always encourage them that that's not the end of the world. Someone can live with HIV positive productively, provided he or she takes the medication well, avoids certain behaviors, that is positive living. What is positive living? Take your drugs in time, avoid alcohol, avoid reinfections, because reinfections also affect you as a person. Then we encourage them to have a positive mind towards life, because HIV is not the only chronic illness that is available. There are other chronic illnesses which are far more worse than HIV. So we give them light at the end of the tunnel. For any activity outside town, we encourage them to come and pick their drugs before they leave. Or when they call us or when we call them, we encourage them to go to the nearest facility. So they go with their cards, or when they reach at the facilities, they make a phone call. We talk to the health workers the other side. So we give them the details. They give them drugs. The challenge of disclosure in relationships, we are trying hard to see that our clients build their self-esteem. That is where APN comes in. We do index testing. Each and every client who comes here, we do index testing. And we do assisted pattern identification. And this has helped us in testing. It covers a wider range, because it covers partners, it covers the social networks. So we are able to bridge the gap of disclosure. Stigma, first of all, begins with a person. It is you as a person, an individual. Because when you talk to some of our clients, the moment someone is tested HIV, he or she feels or thinks that the people around him or her already know that she or he is HIV positive, which is not the case. But someone just imagines the attitude. Now they know that I'm HIV positive, how I'm going to live, how am I going. HIV is like seen like a sin. Yes, it is normal like any other diseases. Yeah? Like we previously had COVID. When we had COVID, COVID came, and whenever they would say someone has COVID, people would stigmatize this person. So the same applies to HIV. We encourage people, the community, not to stigmatize people living with HIV, because if they do, they are making we are not going to end HIV if we stigmatize people living with HIV. Because in that process, we are going to fail on adherence. When someone is not practicing good adherence, the spread of HIV becomes high. The level or the rate at which transmission becomes very high. Because when someone is not taking the medication in the right way, at the right time, the right frequency, this person gets a high viral load. And when this person gets a high viral load, this will cause for the rate at which HIV is, or the rate of transmission will be high. So if we encourage the community to support people living with HIV, sensitize the community, sensitize the family members, even the church leaders, the community leaders, if they're told we sensitize all these people that HIV is a normal thing, I think this will help the people living with HIV not to live in fear, but to believe in themselves. And this will curb down the spread of HIV. Because people even fear, like, if you say that you work with Uganda Cares, you work with TASO, it's like, yeah? People like, they look at you like, what? Yeah? But if people get to know that HIV is normal like any other disease, they will get to understand. And of late, when you talk to people, they like, those who come to us, they tell us, my auntie told me having hypertension and DM, I'd rather have HIV. Because with DM and hypertension, the drugs are expensive. I have to buy the drugs every day. But with HIV, the drugs are for free. So with that, people are starting to realize that HIV is far much better than what they used to think before. Here at St. Valley Kudembe, we provide free quality HIV testing, free quality HIV care and treatment. We also have a wellness hub which provides STI screening, that is gonorrhea, syphilis, and we also provide the treatment. Everything we provide for here is free. We also help our clients overcome stigma. We help our clients adhere well to treatment. So we are trying to make sure that we achieve the 95% of all our clients with good adherence, with non-suppressed viral loads. And then we provide all the services with non-judgmental feelings. We don't judge anybody. The way you come, the way we support you. And during the time, or with all these services we provide, we at least feel happy that clients recommend their friends to come here for the services. And this has really made our clinic become, I don't know, it has really made us who we are, because if you provide quality, quality will speak for itself. Because there is a client who came, she was from another healthy center. She told me that she was told, if you go to Uganda Cares, you're already healed. Yes, because she told us she was told that here at St. Valley Kudembe, the staffs are very caring, they are very supportive, they always provide the best.
Medical care can treat the virus, but overcoming stigma requires change within families, workplaces, and communities. Stay with us. Welcome back. We now look at the personal journeys of people who have moved beyond stigma to live healthier and more confident lives.
Story yange okumanya nti nina HIV yatandikawo eti nali mwana muto nga nkola bwa busigalo. Then boss wange yandeepinga, mukundeepinga navaayo ewuwe ne ŋŋenda ne nzira ewaffe mu kyalo. Wayita emyezi 2 nalwala nnyo. Bwe nalwala mami nantwala mu ddwaliro. Bwe yantwala mu ddwaliro yandeeta wano ku Uganda Cares HIV. Ne bankebera ekyembi ne bazuula nina HIV. Bwe nazuula nti nina HIV, embeera eyo teyali nnyangu. Nafuna stigma, natandika okutya. Abantu abaneetoolodde bwe baatandika okukimanya kuba abamu nabagambako. Bwe baakimanya ogenda owuli ono akwogeddeko kino, kirina engeri gye kifumitamu mu mutima. Oli akugeeza ebbali yali bw'ati, alwadde bw'ati. Abantu batandika okwenyinyala, ekikopo ky'onywereddeko oli abatayagala nakikwatako. Natya nnyo era nze nali ŋŋenda kwetta. Naye olwa Uganda Cares eno y'ensonga lwaki nkyali mulamu. Bambuulirira nnyo, bampa counseling, nensobola okubeera nga nzira engulu. Bannyambako n'okusoma ebintu by'emikono, kulabika nga byenkiipinga ndi bizi obutalowooza nnyo kibi kya HIV. Bannyambako n'ensoma ekyalaani, era kati ndi mu kyalaani. Bannyambako kati nkola nga Girls Act. Girls Act agenda mu bitundu omuli abavubuka abawala, waliwo boys to men but ne Girls Act agenda n'obuulirira abaana abawala ne balema okugwa mu nsobi y'emu gye wakola ki, gye wagwamu. Abali mu ssomero n'obakubiriza okusigala mu ssomero, abali ewaka n'obakubiriza okubeera nga balabika nga tebataayaaya. Nze essuubi lye nnina okusigala nga ndi mulamu, okukola ebintu okuntwala mu maaso, kuba kati kye nayiga nti omuntu osobola okubeerawo ne woba nga nina HIV obulamu ne busigala nga butambula. Obulamu tebukomaawo nti olw'okuba ofunye obulwadde. Era nze nsuubira n'omuntu yenna ali eyo nga yakakafuna okuguma muli eri mu mutima tekiba kyangu, naye mukubiriza okubeera ng'asobola okuguma, okusigala ng'asobola otambuza obulamu, kuba osobola okufumbira, osobola okusigala ng'okola ekintu kyonna ng'omulamu yenna kyasobola okukola. Kuba HIV alinga bulwadde bulala bwonna, osigala otambula nabo nga bw'okola emirimu kasita okkiriza. ali eyandaba bampulira ng'akyalina stigma, kyemukubiriza abeere mugumu, yekwase Katonda, amire empeke ezo. Kasita omire empeke eyo mu budde, n'ofunayo sofunayo G greens mu wiiki, kale ne bw'obifuna emirundi 2 n'olyako kasita omire, bw'oba nti otandika eddagala bakubuuza time gwe gy'osobola okulimiriramu. Bw'oba kati nze mira ssaawa 11, mba sirina kusussamu obwo obudde okusigala nga nkolaki, nga nina okubeera nga ndi mulamu. Naye kasita olizanyiramu, oba ogenda kufuna ebizibu, oba ogenda kwereetera ebirwadde, oba ogenda kuleeta buli ssaawa obeera awo okololawo. Naye bw'osigala ng'olimira, omuvubuka alina kyemukubiriza kusigala ng'amira ddagala lye, nakukola biki ebimutwala mu maaso, aleme kuwuliriza nti oli aŋŋambye bw'ati, kuba bajja kuboogerako. Oli bw'anaamanya tagenda kusirika, kuba buli omu tasobola kusirika, ajja kwogera. Naye ye kyembakubiriza kuguma.
According to the records, I started the medication at around 1.5 years, but I got to know that I'm positive at the age of 6 years, because I was a boy who would ask, why do I take medicine? Why do I take the medication every day, each and every day? So I got to know that I was positive at the age of 6. The stigma that I got, mostly, it was in primary. By the time we studied about the topic concerning HIV and the signs and symptoms of HIV, because we had the boys, there's a boy who was a son to the DOS, who normally bullied us, and he was like, oh master, those signs and symptoms seem to, it seems like Matthias is one of those members, because as you see him, he's skinny, he's thin, he's not that healthy. So, and by that time I already knew that I was positive. It hit in my mind, I was like, oh, even people can see that I'm positive. So I went to the HM, and the HM already knew that I was positive, because if you're joining the school, the staff gets to know about your health. So the HM was like, call the boy, and was like talking to him in a way of comforting me, in a way of making me feel comfortable. And another time when I was in boarding, and time reached to take the medications, so the colleagues were in the dormitory, and I had to take the medication when the colleagues are around. So they got to know, and some of them used that as a defense point. Whenever I get in an argument with them, they would be like, you even have 3 lives, why are you quarreling with us? You're going to die here. Very soon you're dying. So that self-stigma, I faced that self-stigma mostly. But as I was growing up, I got used to the system of HF. So I gained the self-esteem during the youth meetings, the youth campings, the community engagements. I gained that self-esteem, I gained the confidence, and I got to know some new friends. I got to know that I'm not alone. I got to feel that at least some people value me. At least some people can at least see my worth. So the AHF has helped me again, because one day I was like, what if I die? What if I'm going to die soon? As they are saying. But with the AHF, the doctors, the counselors, the youth leaders, the youth coordinators sat with me and counseled me. So I got to know that I have the life. I have the life to live. So with the HF, we managed to come up with the group of young people living with HIV, and we came up with an idea of organizing ourselves to start up a group of training each other. With the skills you have, you come, you train your fellows who doesn't have that skill, but you feel like they would like that skill. And in that way, we managed to get some little money. So now, I personally, I work with Marani Petroleum Company. I get some money, and I'm looking forward to build a company of my own. I would direct them to engage themselves, to get engaged in the youth meetings, the community engagements, so that they get to know that there are other people who are positive in their same age. Because if you don't know that, if you don't get to meet someone who is positive, you'll be like, I'm alone. You come at the facility, you see older people, people in 70s, people in 40s, you'll be like, oh, I'm alone. But if you get to meet your youth, your fellow youths, your fellow young people, you get slowly by slowly you gain that self-esteem and confidence. Because I was a person who, if you start about a conversation about HIV, I would just leave because of that self-stigma. But now, after me getting involved in community engagements, youth meetings, I gain that self-esteem and confidence.
Uganda's progress against HIV is measured in more than treatment numbers. It is reflected in every person who feels safe enough to get tested, every client who stays on treatment, and every community that chooses compassion over judgment. The journey ahead is not only about ending new infections, it is about ending the stigma that continues to stand between people and the care they deserve. HIV treatment has transformed countless lives across Uganda. But for many people, stigma remains one of the biggest barriers to testing, treatment, and living openly. This episode explores the human side of HIV through the experiences of healthcare workers and people whose lives have been transformed by support, dignity, and access to care.